Good evening, everyone, and welcome to Aging Care Navigators, Family Caregivers Connect. We are so excited to have you with us this evening. I surely hope that all of you are having a wonderful, wonderful day. And so this evening, we will just give another minute or so while people are setting up and signing in. And while you are here, those of you who are early, if you can please just drop your name if you're so led into the chat and just share about the role that you're playing. Are you a current caregiver, or perhaps you are a former direct family caregiver? All right, so thank you for those. Thank you, Teresa. Welcome. Welcome, Monique. So again, good evening, everyone, and welcome to tonight's Family Caregivers Connect, Family Caregivers and Health Disparities. I am Dr. PearlHarmon. I am truly honored to spend this sacred hour with each of you. For over the past 20 years, I neglected my health and wellness while working a high-demand full-time job and serving as a caregiver for my parents. So tonight, we've created a space just for you, the family caregivers, the quiet heroes who also give so much of themselves in love, strength, and in sacrifice. We also gather here tonight to have a heartfelt and honest conversation about how health disparities impact not only our aging loved ones, but also us, the caregivers. It is so easy to place ourselves last, but tonight we are shining a light on why your health, your peace, and your well-being matters too. I am deeply honored to be joined by remarkable guests, Dr. SharonJonesEversley, a fierce advocate, a social epidemiologist, and a woman whose life's work has been to uncover and heal the inequalities and for like families like ours face every day. And you are here for a real treat. But before we dive in, again, I invite everyone to please introduce themselves in the chat for those of you who are just joining us. Do share your name. And again, if you're led, you can share if you have cared, who you have cared for, if you're currently a caregiver. We're on a mission to build a sisterhood of strength here tonight. Also, we have provided sessions resources for you, which will be dropped in the chat in a few moments. And then during our time together, we ask you to please use the chat feature to drop your questions or make a comment. Now, it is my joy to introduce our guest, Dr. SharonJonesEversley. It is my honor to introduce Dr. Sharon Jones. We're going to call her Dr. Sharon this evening, a proud Baltimore native, professor emeritus, and social epidemiologist. She made history as the first professor emeritus in the Family Science Department at Towson University and holds a doctorate in public health from Morgan State University. With over 40 years of service in public health and human services, Dr. Jones is a nationally respected voice of health disparities impacting the African American communities. She has authored landmark reports for Maryland's Department of Health and contributed to the upcoming national documentary, The Skin You Are In, which will debut in 2025. Today, she leads Relevant Solutions, providing evaluation services to nonprofits and government agencies. A proud member of Zeta Phi Beta Sororities, Inc. for over 43 years, Dr. Jones is also a devoted mother, grandmother, and woman of faith, dedicating her work in the loving memory of her daughter, Juanita. So please join me in welcoming Dr. Sharon.
Thank you. That was so nice. Thank you for having me. I appreciate it. I appreciate it.
You're quite welcome. So Dr. Sharon, we're going to go right ahead and get started.
Okay.
So, for those of us who may be new to this topic, how would you define health disparities, especially in the context of caregiving for older adults?
So it's so interesting because most of us are very familiar with the term health, right? We can kind of describe our health as good, excellent, or fair. But when public health researchers and scholars brought out disparities, people are like, I got the health part. Not too sure what disparities is, but disparities basically is that where there are gaps in health.
Hmm.
As an epidemiologist, you can call me, as I used to tell my children, I'm like a medical detective. I want to know what, when, why, where things are, why it's
Mhm.
happening to certain people and not happening to others. So when we say health disparities, we're saying that there are some unknown or concerns that we have, that why is it that Black women are discover that they're at stage 4 during their first exam of breast cancer, not 1, 2, and 3? Why is it that we have 61% of Black women that are caregivers to people who weigh a whole lot more than they do, right?
Mm.
Their needs are extremely intense. And so what we do is try to figure out from a kind of public health perspective, why is it with this particular group and not with another particular group? And so, is it personal? Are these personal choices that families have made? Is it cultural? Is it systemic, right? Is it racial bias? Is there ageism, if we were talking about the aging population? What are
Mhm.
these factors that are increasing health disparities, those gaps, those differences, those trends that are having people die younger and sicker? Is it their age? Is it their zip code? So, as a detective, medical detective, i.e., epidemiologist, we're looking for those particular factors. So hopefully that was helpful in kind of explaining, right, what are these behaviors? What are the causes of these behaviors? Because it may be many factors. It may be a
Okay.
combination of factors, personal factors, familial factors, that sort of thing. Mm-hmm.
All right. So we have our very own medical detective with us this evening, and you are absolutely right. And I'm reminded of a recent event that I visited, and they were talking about the disparities of the number of African American women, particularly in this Maryland area, and especially Baltimore, that have been diagnosed with Alzheimer's or another dementia. So to imagine that the small space of Baltimore happens to be the hot spot for such a grave disease. I'm definitely looking forward to hearing more and learning more definitely about how this has shown up, unfortunately, in our community.
Mm-hmm.
And so, Dr. Sharon, our medical detective, when it comes to caring for older adults, how do health disparities show up, like both for the aging loved ones and for the family members who are providing care?
Unfortunately, it's showing up in very startling, dangerous, and very concerning ways, because it's not just health disparities, looking at whether it's Alzheimer's or chronic disease or communicable disease that a aging relative or friend or loved one may have. We're looking at death disparities of not just the person who may have a certain medical condition, but we're also looking at the caretaker and looking at these numbers. And what we're finding is often, and depending geographically, but um, if we were to really look at the data, we're finding that the caregivers are becoming sicker as well. And they're not realizing it, unfortunately. And we live in a society here in the United States where our healthcare is the most expensive among the developing nations, but our quality of health is not wearing too well. Our life expectancy fluctuates, of course, during COVID, but we still have certain groups, people of color in particular, marginalized groups, and their health, their finances are not prepared, one, for Alzheimer's among African American women in particular. The numbers, we weren't prepared. We will get prepared for the census, but people don't prepare us from a public health and health education about that we're looking at these numbers increasing tremendously geographically and particularly among the second largest people of color group population in our country. So people are unprepared. These are unpredictable things and situations. They're not financially prepared. Many people don't have quality health insurance, or if they have health insurance and a primary care provider, some of the services that are out there are not of high quality. So it's it's a hard job, not just to be the loved one who's ill, but also the caretaker as well. So it's really concerning because these individuals are doing what they're doing out of love.
Right.
But it also carries a burden as if it's an obligation. They don't want to complain. They don't want to express their anger and frustration. They don't want to say no. They don't want to hear further bad news. They don't want to ask for help sometimes because this is my mom, this is my dad, this is my loved one that I want to take care of. But we're concerned not just for the person who is being cared for, but the caregiver, their bandwidth is wearing thin, the energy. They're not recognizing the pains that they're experiencing and they're pressing through. And one of the concerns that I really have, to be quite honest with you, and I know we're going to talk about a little bit about resilience, but we have this, I think, very unfortunate expectation of Black women in this country. We train our daughters this, we train our teenagers that we're super women and we're resilient and we can press through anything because we are strong Black women. Superwoman is a fiction. And this ideology that we have, that we are fearless, we are wonderful, we are strong. Black magic, I get it all. You want to say Black girl magic, but Black girl magic is tired. She's worn. And we're putting her in this position as if we are expecting these female caregivers of, it doesn't matter, males, children, older adults. They are ill-equipped and ill-prepared. And individuals that have the means and access to services, quality services for their loved ones, they're like, but they're so resilient. And we give them a pass. Where you have someone who may have lived in poverty or be in poverty, live in a low income community, or that the finances for services that they're receiving for their loved one is mediocre. And we're talking about even lack of support within the family. So this expectation that it's a hard job, we're obligated without talking about and being prepared generationally for what we know are some of these particular issues regarding chronic diseases, your arthritis, your diabetes, your strokes. These are preventable things. And then we also have short life expectancy, so it is something that is very concerning. And then the quality of healthcare, while it may be expensive, it may not be the best quality. And when we talk about disparities, we have individuals that may not be, particularly elderly people, receiving the quality of care that other groups are receiving.
Absolutely. Wow, you're absolutely right. I'm also reminded of how in the African American community, particularly with females and women, we don't usually have the conversations. So it's not common for us to truly have the conversations about our health needs. So if grandma or mama, if someone is ill, they're just not doing well. We're not really talking about specifically what their concerns are. So as we as women are going to physicians in our medical offices, we may not know our family history. So we're not even sharing the family history so that the physicians have an opportunity to help guide us. So thank you again for that. So we know that many caregivers pour everything, as you just referenced, into supporting others. But we often neglect our own health. I'm one of them. I can raise my hand. I'm sure many others can raise their hand if they have scheduled a doctor's appointment and because of the need of care, they cancel. They schedule again, they reschedule, or they cancel. And before you know it, it's a year. It's a year and a half. They're not feeling well. Oh, I'm just so tired. And they're pushing off the signs that their bodies are telling them. So many of us go through this. So from your perspective, what are some of the hidden costs physically, emotionally, and mentally when caregivers don't prioritize their well-being?
An empty vessel can't pour out anything. And we have people that are literally pouring out oxygen, and oxygen and air is needed to breathe, to inhale, to exhale. God breathed into our nostrils. That brings life. When that air is gone, there is nothing left but transition to death. And so that empty vessel, when they don't put themselves first and they feel this guilt and shame, is not beneficial to the person you're serving, and it's not beneficial to yourselves. And so you're at risk of issues of suppressing your anger and your emotions because they aren't authentic, because you feel the shame, you feel the embarrassment, you feel the obligation, and then you self-manipulate yourself by then putting yourself number 14 when there are other things that you really need to do. So the risks are really high. And another thing that is very concerning when we're talking about the United States and we're talking about women in particular, the average age is around 50 years old. That's right there in the middle, right? Half a century. And that half a century, you just got out of your kind of mid-age, and now you're entering into, the elderly kind of issue. So you're not 12 anymore, you're not 25 anymore, you're not 35 anymore. So even from a physical perspective, it is truly demanding, physically, emotionally, the toll, financially, personally. And so we have people who are literally empty and they're trying to be martyrs, but at what cost? And they're oftentimes not even realizing the pressure that is on them is unbearable. And this guilt of, I don't want my loved one being in this poor facility. I want them at home. But are you able to physically do it without assistance? Right. And you have family members that are always going to have opinions of what needs to be done, or I don't like X, Y, and Z. But where are they when that action needs to be taken care of, or the donation to make sure that we're able to afford what's on their wish list, right? These Monday, Tuesday, Wednesday through Thursday quarterbackers, per se. And so it really is kind of hard. So if you're thinking about a 50-year-old who's caring for a 70-year-old, and the average life expectancy in the United States for just Americans, and we're not even talking about kind of like aggregating it based on race or gender, it's about 78 years old. You're literally like at 50 and wearing yourself and aging yourself and losing weight, and some of these issues of stress-related chronic diseases like hypertension, right? Like diabetes. These things are real, right? Neurologically, you are wearing out your cortex and all of these things. And then when we think of the costs, if we're talking about a really good facility for in-home care, that's a lot of money per hour. If you were going to look at, let's say, $6,000 to $7,000 if it's assisted living, daycare. And yes, there are funds that the government provides, but we know that we do not have a government that provides for everything. We're living through a political atmosphere right now where some of the key things of quality of health and healthcare are being compromised, and budgets are being cut. People are losing their jobs. They have no idea. So that's an additional stress. The young people call it life be lifing, but particularly for caregivers, it's beyond lifing be lifing, right? It's so compounded with so many other variables that put them at risk of, I personally like to say, death disparities. They're helping the health of someone else, but their death disparities or the risk of early death, premature death, those incidents, they are at risk of succumbing to it themselves, either before that person surpasses, and I personally know of that, when you have worn yourself out, your nerves are completely shot, you can't sleep, you're self-medicating, right? You feel guilty if you even take a nap. You're not even realizing what's happening to yourself, and that's not really helpful at all.
Thank you for sharing that. I'm looking at the chat and I see that Donita has said she lived by the mantra of being self-full, the balance between being selfish, where caregivers often feel guilty about taking care of themselves, and selfless, which can lead to neglecting our own needs entirely. Such powerful words. Again, a reminder for everyone, please drop any questions that you may have in the chat or make any comments. We will be picking them up in a few moments. So, you've shared a lot of powerful information and knowledge for us to really think deeply about. And I'm sure each of us here can reflect on some personal situations and our own stories. Are there any small but very powerful steps that we as caregivers can start doing today to help protect our health while showing up for the people that they love and that they care for?
Um, One is get your own health check first. Because one of the studies that was done by CDC in 2021 said that 1 out of 5 caregivers report their own health. This is a self-assessment as poor or fair. Okay. So you may have just a couple drops in your vessel and you're acting because of this obligation to save the people, to save family, and to make sure that your loved one transitions with the best quality of life, whether, to expand their life expectancy, and that if they are transitioning, making sure they're receiving everything that they can, that you are depleted. And as I said before, pouring anything out of an empty vessel, it doesn't exist. The air is literally sucked out. So one of the things that I think that I would do is really prioritize your health, right? Do not cancel your annual checkups, making sure your medication, whether you're having it delivered or maybe you may have a day where it's like, hey, we're going to do a couple things, right? Getting, I think, assistance from family as well, understanding your own sense of loneliness, your own sleep deprivation. 9 hours of sleep is now being recommended by neurologists because we live in a country, we don't live in a country when we have siestas and we're calm and relaxed. We live in a very demanding where you are moving each and every second of the day. If you have time for a crossword puzzle, you're feeling like guilty, and that is unfortunate. And so doing things that interest you and even discovering new hobbies is important. Planning it, scheduling it, because write the vision, right? Make it plain, as Abaka says, and plan something that's going to be rewarding to you. If you love shopping, don't feel guilty. And one of the things I think is also seeking medical help for physical issues, maybe a life coach if there are some, or a clinician if there are some mental health issues, because you cannot suppress, ignore some of the signals, your nerves, right? Your hair falling out. You're missing paying your own bills because you're focusing on making sure you're paying the bills of others. Something that you're experiencing loneliness. You're beginning to have brain fog because of the level of stress within your body, the pain within your body. It's not make pretend, it's real. Your own financial status is going to be compromised. Things cost a lot. And so I think that when we think of particular caregivers of aging populations, we have a growing number that are solo, meaning that there is no team. There's no brother and sister, aunt or cousin or neighbor or friend or faith community of volunteers that are coming over. The burden and responsibility has been by force or choice on that one person. That's where the severity of the concern of wellness. Take a walk. For me, I will turn on some Sanford and Son in a second and Different World in a second just to laugh. And if I have to turn on Flintstones, I will just do it because laughter is good for the soul. Turn on some Jill Scott, go to a line dance, right? Those family members with all of the mouth, but none of the time and all of the excuses, you may have to mute them and get your own tribe together of responsible people who can give you a break. Take a walk, plant, get a crossword puzzle, get anything that's going to allow you to relax your mind and body and get some sleep. For some people, it's like, give me a nice vacation, a break. You have to plan those things because if you keep pretending, and this is what we do often, that everything is okay, we don't need anything. Learn to say yes, but also learn to say no. And please stop giving these diseases, chronic diseases in particular, nicknames like sugar, because nothing sweet about diabetes, particularly when we're talking about amputation, blindness, and we're talking about organs that are failing. Arthritis, author is not a friend. Why do we give him a nickname? You know what I mean? Words are spirits. And so we have to be honest. I'm tired. That is a true statement. You are not Superwoman. That is a fiction. You are not a rescuer of everyone's situation. Then when you go to the doctors, you become scared and you're like, this is the cost of my return after I gave my all to my loved ones. And then I think the constant panic of, even if I do it, if I do take a break, the guilt, checking in. Is mom okay? How's dad doing? How's Uncle Buck doing? Okay, that's okay, no problem. I'm on my way. You cannot do that. You're going to have to relax, put your phone on mute, because while you may think you have wings, I've never seen another human fly, and you are not God. And we cannot fear, and the enemy will have you fear like something's bad going to happen because I'm not there. That is a lie from the pit of hell. Our entrance into this world by my faith is appointed, and so is our exit by my faith is appointed. And we cannot be responsible, but we can be responsible for the love and the care that we provide, but we have to be honest with ourselves as well, right? We have to be honest with ourselves as well. And one thing that sometimes we don't like to talk about is sometimes people in families, as well as the people that we are providing for, use levels of demands of manipulation and obligation.
Yes.
Well, maybe if I know, Lord, I don't know what. And then you feel guilty. Do not do anything out of guilt, blame, or shame, because that's manipulation. Let it be real. And stop. If the person is able to go to the casino and pull up the chain, they may be able to do some other things like some arm exercises. If they can watch their little shows sometimes they may need to sit and listen to some quiet inspirational music. So you have to be honest. We definitely don't assume that people are manipulative, but having someone take care of you feels good. Think about the baby when you changing diapers and holding it. They just as funny and happy, but you have to change diapers and things like that with the elderly, and they appreciate it as well. And you want to make sure that you have dignity. Another thing I think of is also making sure you're drinking enough water. We have a lot of caregivers that are dehydrated and they don't even know, right? They're not eating or taking vitamins that they need and supplements. And again, we're looking particularly at females in that age, right? We're talking about menopause. Our whole body is shifting. Our hormones are shifting, right? You having hot flashes, you're irritable. So just think of, for when we think about, particularly right now, where we have a segment of the aging population that literally within the next 20 to 30 years, this will be the largest transfer of wealth. But that's not necessarily for some people of color. That's not their story. They just have enough with the insurance policy to get a funeral. because they've literally exhausted, they've sold the house in order to get the care. They've done a lot of those things. And so they're depleted in so many different kind of aspects of it. So it's important that they drink the water, that they take that time, that they say yes to their body, because their body is speaking to them all the time. The ache, the headache, the blaring of the eyes, the tiredness, the exhaustion, and yet we still push. And we need to stop it. We definitely need to stop it. We need to eat well and eat nutritiously. And I think that we need to ask for help, because we're not. Because it's like, well, no, they don't want strangers. Well,
Right.
after about 5 different visits, this isn't a stranger anymore. This is Miss Mary who's coming to help me do X, Y, and Z. Lifting up bodies, whether the person may be under 100 pounds or over 300 pounds, it's taxing on your body, on your muscles, on all of those things. So getting exercise, taking walks, those things are very, very helpful.
Fantastic. So you've mentioned some simple steps that we can take and we have control over. So we have making sure we're hydrated, drinking lots of water, spending time outside as much as we can, even if it's sometimes you opening up a window and sticking your head out there or the door to get some fresh air. Dancing,
Mhm.
of course, listening to music, puzzles, any of those things that can just take place within a few moments within the time that you have. Because folks always say, I just don't have the time. But I hear you say we have to prioritize ourselves. So before we set the appointment for our loved one, set our medical appointments. Make sure that we're taking our medications and following what our doctors are saying. And most importantly, being honest with our physicians and pushing back and really being advocates for ourselves while we're supporting them. All right, I see there are lots of comments popping up in the chat. So, we're going to kind of wrap it up with a final question. You referenced some of these things in your previous responses, but I want you to just talk a little bit about resilience in our families. Like, what words of encouragement would you offer to women here tonight or individuals here tonight who are balancing this work of caregiving, working, and everything else in between as we eliminate concept of being super powered, super women, and super gentlemen?
I'm going to start by using Hebrews 6:10. It says, God is not unjust. He will not forget your work and love you that you have shown to him, as well as helping his people. Um, God sees you. He knows you. Call upon him. The God that you serve, right? Or whatever your spiritual beliefs are just important, because you cannot do this on your human flesh and understanding. This is a sacred work that is being done, loving someone to health. And again, also, we talk about words. Please stop saying, I love you to death. No, don't love me no doggone death. Love me to abundant living in life, but don't love me to death. We have to be careful about words, but let me get back to what I wrote down. You can love and care for others without abandoning yourself. You can love and care for others without abandoning yourself. You matter. Your health matters. Your relationships. Often we just shut down. No friendships, no sex, no laughter, no nothing. Most people, they don't even have time to go to their church, which used to be, or their mosque, which used to be the place where they fellowship, because they are 24 hours concerned. And I do not believe that is the way we were created to be. We're to serve, but we're to serve with wisdom and discernment. Your life is important. And if you don't take the time, then people will be taking the time to visit you in the hospital or to the cemetery, right? Or to your memorial, right? That's just a reality when we look at the numbers. It's not to scare us, but it's to say abundant life doesn't cease when we're carrying someone. We have to be wiser without the guilt and the shame. And like I said before, I just don't believe that guilt and shame is of God, right? I think that we have to be honest. I think that we all need support. Have that tribe. Some of it may be blood relatives and some of it may be complete strangers. Get as many resources as you need to do. And just a reminder that it was a statement by a Professor Edwards. She's at the Samuel Du Bois Cook Center at Duke University. And she said if Black women didn't have to fight for everyday life victories or survival, imagine the greater level of creativity and innovation that could happen, because we need a break and we have to be unapologetic, and we don't have to ask anybody for that break. We have to take that break, right? Taking care of yourself, because there are benefits to what you're doing, but there are risks that you cannot ignore. So instead of feeling guilty, look at the risk and try to minimize the risk and harm that you are doing to yourself, because an empty vessel cannot pour anything out to anyone if they're not being replenished and refreshed.
Absolutely. My gosh, my gosh. What a powerful time we have had with you, our medical detective, from sharing with us what disparities is to talking to us about how that actually shows up in our bodies, the way in which we feel, the way in which we ignore many of the things that are happening with us, and we just kind of push it aside. So we really want to open up the space for any questions from our audience, from our
Great, great.
participants. I'm looking through the chat to see if I see any questions. Or you may also raise your hand and we will definitely unmute you to make sure that we address any questions that there may be. So let's see. I don't see any in the chat. So if anyone that has a question, please raise your hand or you can just come off mute and we will address those questions for you. I know one question that I was talking to someone recently and they shared, and I think you talked a little bit about this, but how do we work through the guilt? Work through the guilt, even when we find someone, a family member or caregiver to come and provide a respite. But we know that our loved one is still struggling. They're going to call our name and they're just going to not be the same because we feel that we are this space of comfort to them. How do we work through that guilt?
I think acknowledging that you're not a rainmaker nor a magician, that
Mm,
those feelings may exist, but they don't have to be dominant. And when we think of guilt, we're thinking of you did something wrong. And I think we need to reimagine that statement. Am I doing something wrong by acknowledging that I cannot do this and I need help? And even though mom or dad or Uncle Buck or my second cousin Barbara may be dealing with their physical, mental, or both challenges, I will explain as best as I can, but I will not feel guilty about getting that help. I
mm,
will transition, right? But also saying, oh, you did really well. I will make sure it's quality. Sometimes you have to fire people, reassign people, right? But you need that kind of participation. And depending on cognitively where that loved one is, just the fact that they're feeling good because they're clean, they were just cleaned and they're in a clean bed and they were able to see the sunshine if they rolled themselves, or went outside or sat on the porch or did whatever, you know what I mean? And that's not something to feel guilty about when you're not doing anything wrong. You're doing something that's being a blessing, because this is sacred help. And so I believe that we have to give ourselves some grace and some mercy. And this overthinking isn't going to help either. Trying to figure, you're not God. You're
mm,
not. You're not. You
absolutely.
don't. You don't. So just acknowledge you are a loved one who cares about the quality of care and life of your loved one. And you volunteered or were forced into that position. Some of it was unpredictable because life happens very quickly to many of us. could be a fall, it could be an accident, it could be a brand new diagnosis. Didn't know, didn't expect it. No one even had the symptoms. It's unexpected. So how can you be expected to be perfect, which does not exist,
Right.
for the unexpected, right? But what you can do is do your best and trust God with the rest without the guilt. Guilt is not of God, it is of the enemy, because we're trying to please who?
Mm.
We're in partnership with God
Mm.
with this. To me, caregivers have like a little corporation, and the CEO is God. I think you have a question. I don't see all of the pictures, but I think I saw Dr. Brown, whose hand is up.
Well, it is. It's Dawnita Brown. I'm not doctor yet, but I'm on my way. I'm a
Well, I'm
DRPA
speaking
student.
prophecy.
Yes, you are. I'm a DRPA student at Hopkins, and the work that I'm
Yes.
doing is around Black daughter caregivers, creating culturally relevant interventions. And so everything that you were sharing just resonated with me on so many levels. As I shared earlier, I care for both of my parents. My caregiving journey, where I identified as a caregiver, started with my mom. She had a brainstem stroke when I was serving as a Peace Corps volunteer in Africa. So, as you were saying about just the lifestyle here in America, like I lived a totally different lifestyle. So, when I came home, I just had to readjust. And it took me a minute to get to a place where I put me first, because I'm like, I can't go before you all. I feel like I'm taking care of you. I have so many more years to live. I don't want to go before you. So I just appreciate all of everything that you shared. I even loved how you described yourself as a medical detective, because I have to take epi and I'm so fearful of epi, but I'm going to
No,
take
love it.
that.
It's
Yeah,
good.
I'm going to take that with me. I might have to reach out to you. But I also have created a community for Black daughter caregivers called the Binti Circle. And so everything that you were saying, we create that space within the Binti Circle, providing respite, providing fun, culturally relevant interventions, providing that support, that tribe that you mentioned earlier. So this was very informative. Thank you so much for being so real and relatable. And I'm grateful that you all have created this platform for tonight.
Thank you. Thank you.
So much. There's another question from Lana. I see a hand up.
Yes, my question is, you mentioned to take care of yourself, but if you are being abused by the one that you are taking care of and you don't have a tribe, what would something you would recommend?
One, that abuse of anybody, whether it's the person that you're taking care of, and when you say abuse, it could be mental, it could be physical. Those are the things that we need assistance with, because at the end of the day, there may be neurological challenges. It could be just the person's personality. For some reason, we think all old people are sweet and nice, and that's not necessarily true. There are people who are mad that they're immobile. They're disgusted that nobody's coming to visit with them. And this is something that you have to put up some safe boundaries and learn that you're not a punching bag. You know what I mean? Being cursed out, sometimes you got to forgive. I'm not saying curse them back again, but you have to teach people how to respect you, but you also need to know when that particular level of abuse may be too much for you to handle, because you're trying to manage chaos. Chaos and cannot be managed well. So there may be some mental health services that may be needed to be provided. There may have to be someone who's coming in to assist you to calm down. It could be medication. It could be some kind of non-medical or medication that's not necessarily needed, some massaging or things like that. There may be a brain tumor that has been undiagnosed that could cause those kind of personality changes. But again, if you can't be the punching bag or the bad person here. You got to say, no, mom, that's not right. No one stole anything from your purse. Here it is right here. And then sometimes they'll be like, oh, right, you're right, tutti frutti, there it is right there. That's fine. But if they're like throwing things at you, I think you need to close the door and get some help, like some common sense things, because this is a indicator that the level of care, right, if we're honest with ourselves, is much more intense than it was maybe 3 months ago. And there needs to be some other components added to that, right? It may not be that the person's diagnosis changes and it still elevates, but there may be things that you need to share, because what you don't want to do is then have the Adult Protective Services then investigating you for elderly abuse, right? We're talking
Are there
criminal.
hotlines available? Are there hotlines available for things
There
like
is
that?
with the state of Maryland, and one of the great programs that Maryland has, they launched it in 2023. It's called Aging Longevity, where they really are providing services to really ensure that the quality of life for Marylanders, it doesn't matter where you live, is better. So there's a lot of funding that the governor has put into that program, Aging Longevity, to ensure certain things like that. Also calling the Department of Human Resources, their Adult Protective Services agency, for help and assistance with issues like that. Because we don't want to be reactive. We want to be wise, and to kind of get that information that you need, but you cannot become a victim, and you cannot become somebody's punching ball. And mentally, that toll, physically, financially, will make you angry. We're human, right? We're human, point blank in a sentence. And you have to be aware of when it is enough is enough. Because as I said before, some of it may be completely part of the person's diagnosis, but some of it could be manipulation and taking advantage of the one person, right? Things like that happen. We can't assume, but you definitely need to have it checked out by a medical health profession. You have a
All right.
Teresa and a Cynthia that have their hands up.
Cynthia raised her hand first, so we'll start off with
Okay,
Cynthia.
good. Mm-hmm.
Yes, I'm unmuting myself. I was a caregiver. I was listening to a number of the other women who spoke. I was a caregiver for 20 years for my mother, and it was very, very difficult. I did have some family help, but specifically, I'm interested in joining a group. I don't know of any other groups right now. In fact, I heard about this Zoom meeting by way of one of my colleagues at Morgan State University. But I'm very interested in becoming a member of a group or some groups that include people who have been caregivers, because in a way I would still like to give back, but I am in need of a support group based on the number of years that I, in fact, was a caregiver. So perhaps you can give me some information, I'm sure, about some groups in the Baltimore, Maryland area that I may be able to associate with, just to have a group to be a member of, because that's really a desire of mine.
Well, I
You're
know
in the
Dr.
right
Pearl,
place.
right? I was going to
Welcome.
say Dr. Pearl is going to help you, but before she says that, I just want to say thank you to Ms. Brown, and thank you to you, Cynthia, for the work you do. So often when we are in communication with the military, we say thank you for your service. And I like to say thank you all for your sacred service. You too, Lorna, as well.
Absolutely.
Thank you.
Teresa.
Hello, my name is Teresa Robertson, the Caregiver CEO, and I love that the speaker mentioned that caregiving is like being a CEO. And I'm getting a prompt here. I wanted to mention resources because someone was asking about, the conversation came up about Longevity Ready Maryland. I'm a member of the Maryland Commission on Caregiving, and there are resources available in every county in the state of Maryland. You can access those resources by dialing 211, but nationally in every state, you have access again to dial 211, ask for the Family Caregiver Support Program office. And when you get that office, ask them to do an options assessment where they will tell you every program that you're entitled to as a family caregiver. These are programs to support you in getting help. And if you have a situation like the woman mentioned where there may be some abuse happening, they can guide you in that direction too. They can tell you what programs or what resources might be available to help.
Thank you so much, Teresa, for sharing that. And I see there some other spaces have been dropped into our chat. So we'll definitely send an email out to everyone with the resources that we are collecting this evening. Are there any other questions or are there any comments or feedback from any of our caregivers who are living and breathing this each and every day, or perhaps you once were as you traveled this journey? We really love to hear from you if you have anything to contribute to our conversation this evening.
I would just like to say thank you all for doing this. As a former caregiver and as somebody who's not necessarily giving direct care right now, but doing indirect care, this was very valuable. And I hope that you all will consider doing something like this on maybe a biannual or quarterly basis. Thank you.
Thank you, Jennifer.
Hi, this is Pam Limberry. Thank you all again. I certainly echo what the previous person had just said with regard to this space. So I actually am a caregiver. I don't take care of relatives, but I take care of other elderly as well as those with developmental challenges. And we just started a caregiving business on the Eastern Shore. So the thing that I want to add to the conversation is one of the most difficult things to have conversations with family members is to, I guess, kind of release themselves from the guilt, of course. But the fact that, you know, a wife thinks that she can take care of her husband, and a husband thinks that he can take care of his wife. And that's not always the case. And it's typically, in my experience of 20 plus years of doing this, it's usually not the best scenario. And so one of the things that, I always assist people with is having the conversation ahead of time to keep the sacred role of the relationship as it was. If I'm a daughter, be a daughter. If I'm a cousin, be a cousin. If you're an aunt, be an aunt, whatever it is. Because sometimes with that role reversal, they say twice a child. They're not twice a child. They're just aging in a different way. And so they shouldn't be treated as a child, but with dignity. And so I always encourage that, aging in place, one, because I do that as a business, but also typically that's the route that seniors typically want to do as opposed to being in a facility. And so that's the encouragement, to just encourage others to maintain the role that they have relationally in the person's life.
Thank you so much for sharing that, Pamela. That is so very important.
Good
All right.
evening.
Yes.
Can I make a, yes, my husband and I, we thank you so much for the information. What we wanted to say, my husband had been a caretaker for many, many, many years for his father, who is now, tomorrow he will be 103. But what we wanted to say was know when enough is enough, because sometimes we don't realize when it's time for us to step away from that family member and use our resources. Like at this time, he's 100, he'll be 103, but we had to relinquish what we were doing and step back and use the resources of assisted living.
Right, because I still had to work. I left early in the morning, didn't get home till early evening. My lovely wife, Cheryl, was with my father. She was also caretaking 4 little children at the same time. And she held out until I retired. But she's really a trooper with that. She held out till I retired. And it was time. So I had my father put into a residence. But
And don't feel guilty, because
Right,
sometimes you have to do that. Oh, why didn't you, if you can't do it, you can't do it anymore.
But that
If
was
you, yeah, so
rough, and I still had to work. Go ahead.
right. So utilize the resources that they mentioned tonight. Um, I think it's okay to ask for help. Most of us don't want to ask for help because that's our family member. We love them. And then we'll put the guilt trip on ourselves. Oh, we don't want anybody to do that to us when we get older. If you can't do it, you can't do it. It's okay
Absolutely.
to ask for help. So thank you so much for all the information. Thank you for this group. Thank you for the resources. It was really wonderful. Thank you.
Thank you. Your hand from Cheryl.
I just want to say this was phenomenal, 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 phenomenal. Dr. Pearl, I really appreciate this. And Dr. Sharon, Sharon, I really appreciate the information. One thing that stuck out to me is still, even though I was taking care of my mom who turned 90, I lost in 2020. But the first thing that I had to do is take care of me. And I didn't know how to do that. That's the first thing you do. That's the number one step. And so I just want to say thank you, thank you, thank you, thank you. Because now I can take this information, all the tools that I am learning, and apply them to my life so that I can help someone else.
You
Thank
remember
you.
right. But you know what? You brought up a really good point, because self-love is not selfish. It's a necessity.
Absolutely.
And neglecting your self-care is your invitation to an early grave. You have to do it. We have to rewire our minds, because God says, I want you to love your neighbor as you love yourself, which means
That's
I
right.
learned recently, about 2 weeks ago, I have to love me. Right? I have to love me. I have to love me.
Absolutely.
Yes.
Thank you so much. So we'll have the last comment from Vanessa, because it is nearing our 8 o'clock hour, and I definitely want to be respectful of your time. Yes, Miss Vanessa.
Okay, hi, good evening. I wanted to first thank you all for the invitation. Dr. Sharon, thank you so much for inviting me. I've really, truly enjoyed, I have an assisted living facility, and I treat my clients as though they're family. I've been doing it since like 2011. And it was also just confirmation for me as well, because I was really struggling with one of my clients that's been in the hospital and back and forth whenever she gets discharged, including as early as yesterday. She ended up going right back. This particular time, she told mobility that she didn't live here and that she was not getting out and do not go past the block. And I felt kind of bad where, because I'm so connected to my clients, and I feel like that I'm obligated to care for them. But just in hearing the information that came forth was very touching for me, and to have me to realize that it's okay. Sometimes other resources has to be put in place, and I can't do it all myself. So again, thank you so much.
Thank
First,
you.
thank you, thank you. Again, before we close tonight, I definitely want to take a pause and say thank you to each and every one of you. Thank you for showing up for yourselves this evening, for showing up for your loved ones, and for making space for yourself, even when you're carrying so much burden and load for other individuals. Of course, we are thankful for our medical detective, Dr. Sharon, for just pouring out her heart, her wisdom,
Pleasure.
and honest truth with us this evening. Your words reminded us that we are not invisible in our care for others or for ourselves, and we are more powerful as a collective group than we are individually. So I hope tonight that each and every one of you had an opportunity to feel seen, to feel heard. And I truly pray that as you're leaving this space this evening, that you're a little bit lighter, just a tad bit lighter, a little bit stronger, and a little bit more committed to really caring for yourselves as you lovingly care for others. So if you haven't grabbed our resource, we did drop it in the chat earlier. We will drop it in the chat again. I will definitely email out to everyone. We do host Caregivers Connect every month, which is the fourth Tuesday, excuse me, of each month. Our next one will be on May 27th, and it's called Moments with Mom. So it's for anyone out there, please share the information with others. We're going to spend some time, whether you currently have your mother, whether your mother's no longer with us. We just really want to spend some time together. And so we will be meeting again on the 27th of March. The other items that I shared in the document that you have is really a space for some reflection for yourself, which is part of the journey of taking care of yourself. There are also some other tools in there that's going to help you organize caring for yourself as you care for your loved ones. The other item, Elmer, can you please put up the other document that we have for our guests? I do, again, thank you for spending your time with us. Aging Care Navigators is a heart project. It's my passion. Because of the years that I spend caring for my mom, because of the years that I spend just being a support for other family members and other individuals in general, I've been led to do this ministry. And so we spend a lot of time, spend a lot of resources supporting everyone that we can. So if there's anyone who's willing to do a donation, there is a link that we can drop in, give of your heart. What did we do? We had a great time this past New Year's Eve with the Little Sisters of the Poor. We sponsored their New Year's Eve party, and it was just such a joy and such a blessing. And we have also spent some funds and just tried to provide some respite to some of our caregivers out there through just some random donations. So know that you're not alone. You're part of our sisterhood. I can be found, Aging Care Navigators can be found, of course, on Facebook and on Instagram. I do have a couple of supplemental journals and documents that will support individuals. For example, Family Caregiving's Gratitude Journal is there for family caregivers to simply, again, have a space to collect their reflections and their feelings while they are also caring for their family. So I really created that document, that journal, with this parallel role that you're living, yourself and your loved one. And also, coming up in June is called the Family Caregivers Wellness Medical Binder. It is a guided notebook, a space for you to truly put your health at the forefront of your life. So in June, it will be released. I dropped a few pages in the document that I shared with you this afternoon so that you can see what is coming forth. And I am so thrilled to also share that in August, I will be co-authoring a book. It's called Caregivers Advocate, and it is really talking about how do you utilize each and everything that you do every day and step into this leadership role. So all of that is forthcoming. But again, we're a little bit past the hour. I thank you so much for your time and your attention this evening, excuse me. This is the document, the book that is coming forth in June that is up on the screen. And so unless there's any final comments or thoughts, I would love for you to leave some final thoughts in the chat if you are so led to just capture some of your reflections for today. It can just be one word that you drop in that chat about your time with us this evening.
Great. Nice.
I've also included my website and my email in case anyone wants to get in touch with me directly. I'm open. Please email me anytime. I will get back to you with any questions that you have. But again, I will make sure that all the resources that was shared this evening is shared with everyone who has registered, and I do have your emails. So if I don't have your email because you came in maybe through through an invitation, please drop your email in the chat and I will definitely share everything with you. So again, Dr. Sharon, applause for you. Thank you, Monique. All right. So at this time, have a wonderful evening. Have a wonderful rest of the week. And again, if there's anything that any of us, myself or Dr. Sharon, can do, please do not hesitate to reach out to me. I really appreciate you, and I'm so thankful for the journey that you're on and for stepping up. because I'm sure there's others who could do what you're doing right now, but for whatever reasons, they are not doing, they have not. And you have been called to do it. So thank you, and we appreciate you. Have a wonderful evening, everyone.
Bye-bye.